What is diabetes? Introduction. Diabetes mellitus is a very common disease in our days, and its consequences and complications can be very serious, to the point that they can seriously limit our state of health and even lead to death. The Diabetes Management channel aims to disseminate relevant information and knowledge about this disease so that the society of the 21st century can face it successfully. Previous concepts. In order to better understand the meaning of the disease known as diabetes mellitus, it is necessary to assimilate some basic concepts. What is a metabolic disorder? A metabolic disorder occurs when there are abnormal chemical reactions in the body that interrupt or alter a specific biochemical process. When this happens, you may have too many or too few substances that your body needs to stay healthy. Examples of metabolic disorders: diabetes mellitus, dyslipidemias, alterations in body fat such as cholesterol and triglycerides, high blood pressure, etc. What is glucose? It is the simplest sugar, monosaccharide, found in the blood. From the biochemical point of view, it is a carbohydrate. Glucose is the most important source of energy to keep the body's mechanisms functioning optimally. Another important source is fats. When your glucose levels are optimal, you often don't notice it. However, when you deviate from the recommended limits, you will notice the detrimental effect it has on the normal functioning of the body. People get glucose from carbohydrate-rich foods such as bread, fruits, vegetables, and dairy products. You need food to create the energy that helps you stay alive. Although glucose is important, like many other things, it is better to consume it moderately. Glucose levels that are unhealthy or out of control can have permanent and serious effects. What is the pancreas? It is an organ that is about 6 inches long, is located in the abdomen, behind the stomach and in front of the spine, and has 2 fundamental functions: segregates digestive enzymes that pass into the small intestine. This is its main function, and it is essential to digest well, especially fats and proteins. It produces 3 types of hormones that pass into the blood: insulin, which regulates our energy, glucagon, and somatostatin. All 3 are related to each other and must be in balance to maintain correct blood sugar levels. What is insulin? Insulin is the hormone that allows cells to obtain glucose, which is the source of energy from food, to help us perform all our daily activities such as walking, running, cleaning the house, exercising, reading, going to work, cooking, among many others. It is produced in specialized cells called beta cells located in structures called islets of Langerhans in the pancreas. Now we are in a position to know what diabetes is. What is diabetes? Diabetes is a group of chronic metabolic disorders characterized by the increase in blood glucose resulting from defects in the production or action of a hormone produced by the pancreas called insulin, or both. What are the types of diabetes? Type 1 diabetes. This type of diabetes was formerly known as insulin-dependent diabetes mellitus (DMI). This, due to the autoimmune destruction of beta cells, usually leads to an absolute insulin deficiency. Type 1 diabetes usually appears before, during, or shortly after adolescence, so it is also known as juvenile diabetes, although in reality there is no age limit. Patients with type 1 diabetes need insulin all their lives. In the absence of insulin, there is a risk of diabetic coma. Type 2 diabetes. Previously it was known as non-insulin dependent diabetes mellitus. In this type of diabetes, there is progressive loss of insulin secretion from beta cells. It is known as insulin resistance. That is, in type 2 diabetes, patients have enough insulin at the beginning of their disease, but their body cannot use it correctly to lower blood glucose. Overweight and obesity are 2 factors that cause type 2 diabetes, which is usually diagnosed after age 30, but more and more young people suffer from it. Type 2 diabetes can be controlled by monitoring sugar levels with a diabetic diet and exercise. You can also use oral medications. If left unattended, diabetes can get worse and patients may need insulin. Prediabetes. It is a term used to refer to the risk situation of developing type 2 diabetes. In most cases, people with type 2 diabetes mellitus previously had prediabetes. Prediabetes is a disorder in which the level of blood glucose is higher than normal but not so high that it is diabetes. For example, when fasting blood glucose is between 100 to 125 mg per deciliter. Gestational diabetes. For several years, gestational diabetes has been defined as any degree of glucose intolerance during pregnancy, regardless of whether it existed before or after pregnancy. However, given the obesity epidemic, it has been detected that some cases involve pregnant women with type 2 diabetes. Gestational diabetes involves risks to the mother, the fetus and the newborn. Cystic fibrosis diabetes. People who suffer from cystic fibrosis, chronic obstructive pulmonary disease, usually develop diabetes because the function of the pancreas is usually affected, so that not enough insulin is produced, just as it happens in type 1 diabetes. Post-transplant diabetes. Hyperglycemia refers to high blood sugar levels. This condition is common in patients who received an organ transplant. The ADA Diabetes Document 2019 states that up to 90% of patients who received a kidney transplant had an increase in their glucose during the first weeks after surgery. Monogenic diabetes. It is a rare type of diabetes, product of mutations in a gene. It usually affects children and young people more frequently, particularly newborn children. It represents less than 5% of patients affected by diabetes. The most common type of monogenic diabetes is MODY, maturity-onset diabetes of the young. Which are the diabetes causes? There are many processes involved in its appearance, ranging from the autoimmune destruction of the beta cells of the pancreas to alterations that lead to resistance to the action of insulin. The basis of all metabolic abnormalities is the deficient action of insulin on white tissues. The latter is due to the inadequate secretion of insulin or the decrease in the tissue response at some of the different points of the complex hormone pathway. What causes type 1 diabetes? Type 1 diabetes occurs when the immune system, which fights infections, attacks and destroys the beta cells of the pancreas that produce insulin. Current research has established that type 1 diabetes is caused by genes and environmental factors, such as viruses, that can trigger the disease. What causes type 2 diabetes? Type 2 diabetes, the most common form of the disease, is caused by several factors, including lifestyle and genes. A person is more likely to develop type 2 diabetes if they are not physically active and are overweight or obese. Sometimes, excess weight causes insulin resistance and is common in people with type 2 diabetes. The location of body fat is also important. Excess belly fat is linked to insulin resistance, type 2 diabetes and heart and blood vessel diseases. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver and fat cells do not use insulin properly. As a result, the body needs more insulin so that glucose can enter the cells. At first, the pancreas produces more insulin to meet the increased demand, but over time it stops producing enough insulin and blood glucose levels rise. As with type 1 diabetes, certain genes can make a person more likely to have type 2 diabetes. The disease has a hereditary tendency and occurs more frequently in these racial or ethnic groups: African Americans, Alaskan Natives, Native Americans, Americans of Asian origin, Hispanic or Latino, Hawaiian Natives, and natives of the Pacific Islands. What is the cause of gestational diabetes? Scientists believe that this type of diabetes that occurs during pregnancy is caused by hormonal changes, genetic factors and lifestyle factors. Insulin resistance. Certain hormones produced by the placenta contribute to insulin resistance, which occurs in all women towards the end of pregnancy. Most pregnant women can produce enough insulin to overcome insulin resistance, but some cannot. Gestational diabetes occurs when the pancreas does not produce enough insulin. As with type 2 diabetes, excess weight is linked to gestational diabetes. Women who are overweight or obese may already have insulin resistance when they become pregnant. Excessive weight gain during pregnancy can also be a factor. Therefore, weight control during pregnancy is essential. What are the consequences of diabetes? The consequences of diabetes affect both the health and the quality of life of the sick. Over time, diabetes can cause serious damage to the heart, blood vessels, eyes, kidneys and nervous system, and even lives can be lost. Adults with diabetes have a 3 times greater risk of myocardial infarction and stroke. Neuropathy of the feet in combination with reduced blood flow increases the risk of foot ulcers, infection and ultimately amputation. Diabetic retinopathy is an important cause of blindness and is the consequence of the damage that accumulates over time of the small blood vessels of the retina. It is one of the main causes of kidney failure. Did you like this video? If so, please subscribe to our channel so we can send you notifications about our new released videos. Thank you.